thank you very much for your time this evening. I'm going to tell you something that I think's pretty incredible, actually, that I think is going to transform a whole load of health and care systems. And the incredible thing is, it's really cheap, it's easy to do, and there are nearly no side effects. A treatment that's cheap, easy, and no side effects. Sounds too good to be true. All of you, I guess, or many of you, at some point in your life have used the opinion of other people to make a decision. More recently, you may have gone online and looked at ratings and reviews. Has anyone done that for a holiday or a book or a restaurant, hotel? Yeah. It's part of normal life. And the reason it works for so many people is that done properly, ratings and reviews and the opinions of other people are a very powerful metric to predict quality, to predict safety, to predict good value and satisfaction. And what I 6 years ago did was say, how can we bring that insight, that system into healthcare? It just seemed ridiculous that you can get your phone out and find out about the restaurant there or the restaurant in Adelaide or a hotel in the Lake District. But, to Professor Richard's point, you don't know where the variation is. And to his slide, the variance across healthcare is large, important, and significant. And that's a sentence or two sentences, but what it means is where you get your care, where you take your children, where your grandchildren are treated, makes a massive difference to their outcome. And as I was thinking about this is very much what I normally say, I realised that I didn't need to tell people in Bristol that there is variance in care. But what's also incredibly important, which you know so well, patients, families, all too often know. How many times has it been patients and their families especially speaking up and saying things aren't right here? And whether it hasn't been detected by systems in the past, because as we've heard, and I've seen firsthand, the CQC is a completely different organisation to what's come before. But still, the point's been made already, it can do better, it can do more. We've talked about hospitals. Actually, again, without diminishing the huge work that's been done, hospitals are relatively easy compared to primary care. 10,000 GP practices, even with 3 helicopters, you'd be struggling to get around those. All the nursing care homes, all the social care, the care that's delivered in people's houses. How are we going to monitor the quality there? What's really, I think, the thing that's most exciting is that if you do it properly, the experience of patients and their families, simple ratings and reviews, predict safety. They predict outcomes. They predict cost effectiveness. And really interestingly, they predict staff morale. And we've already heard how staff morale is linked to quality. So what we did with I Want Great Care was say, let's create a TripAdvisor for health. Let's make sure that every patient, every family, every carer can rate and review their care. Their surgeon, their GP, their dentist, the ward, the home care team, the clinic down the road, their GP practice. So we founded this organisation 6 years ago. As you can imagine, probably didn't go down that well with some doctors. You're going to be rated and reviewed. It's going to go up on the internet transparently for every other patient to see, for your professional colleagues to see. Wind the clock forward to today, 6 years later. We have over 1.3 million reviews of UK healthcare live on the web. It is far from perfect. There's still pockets where it's not being done enough, either because the organisations are resisting or because people just don't know about it. Interestingly, in the Southwest, the teams that took it on first, palliative care services, the hospices across the whole of the Southwest, with a few exceptions, asked the people they look after and their families, tell us how we're doing, rate and review the care. And I had an email from the director of that team this week, and she said, it's fantastic. The feedback has driven staff morale up, because most feedback is good. That's not to say it's all perfect. She said, but it's also highlighted things we can do better. We've already made changes in months based on the feedback that we never would have done before. But because we have a single comparative system, again, consistency of the approach, the hospices in the southwest can compare themselves to the hospice care in Wales or the hospice care in Ipswich. And that's just one example. And what happens then is you get a sort of healthy competition, because healthcare professionals are passionate about their patients, passionate about doing a better job, getting better outcomes. And when you show them where they are in this sort of league table, as you've alluded to, they want to be at the top. And the people at the top want to stay there, whether it's an emergency medicine department, a hospice, a GP, a dentist, and the people lower down go, we don't want to be there, we want to get up. So when you put this system in place, for example, across an acute trust, and some of the organisations that Professor Richards referred to, the most challenged organisations, Morecambe Bay, King's Lynn, George Eliot, have put the I Want Great Care system in place. Clearly, it's more than just one system, but a very good system to collect continuous patient feedback, to show people how they do compared to everyone else, combined with good leadership, drives up standards. Morecambe Bay, 2 or 3 years ago, a few very poor, bad clinicians led to some very bad outcomes for families and babies. Those people have long since gone. But of course, everybody who works there, the midwives who work there, every time they open the newspaper, they said, the Morecambe Bay unit that kills babies. You can imagine what that must feel like as a midwife. Morale goes down and down, however hard you try and pick it up. When morale goes down, sickness and absenteeism goes up. That costs the NHS a fortune and leads to worse care. So we put in place a system where every family, and it wasn't just across maternity, it was across the whole organisation, everybody is asked to rate and review their care. Number one, everything they say goes up on the web, transparently. It's about building trust with the local community, especially communities who've had their faith and trust in their NHS sorely tested and stretched. So every word goes up publicly. Build trust, confidence. We are an open organisation. We are listening. There is not going to be a Mid-Staffordshire here. The patient voice is paramount. Secondly, every Monday, what the patients have said about that ward or that team or that clinic is fed back to the professionals. Simple sheet, very graphical, ratings in a star rating system, how they compared to every other ward in their area and now nationally. And then, and this is the critical bit, every word and every comment that families and patients have said. And even when organisations are struggling, there's still a lot of goodness in there. As we've seen, you might have a bad hospital with a superb paediatric unit. You feed back the good news, morale goes up. In Morecambe Bay, in 3 months, sickness and absenteeism in the maternity and women's health team fell from 7% to 3%. Their finance director estimates that will save them £500,000 on using bank staff and temporary staff. £500,000 that goes back into patient care, because you're building the morale of the teams. And wherever we sit here, whether you're patients, professionals, managers, you will understand that if the morale of the NHS workforce falls, we are all going to suffer, both financially and in the quality of care. So, you harness and collect feedback from patients, whatever their language, whatever their learning ability. We provide service in 18 languages, versions for easy read. People with dementia, we can even capture feedback there, online and offline. You collect it all up, you analyse it, you put it all on the web, transparently and clearly. I want patients to be able to choose. I want when you say, I wonder if there's another GP I could move to. How are you going to make that decision? Well, we've got GP practices who've got 500, 600, 700 reviews from patients. I tell you, you read them, you get a feel for what's going on. Similarly, where should you have your baby? Where should you have your hip replaced? Is Bristol the best place for that? What we want to do is put the patient experience side by side with clinical outcomes and safety data so you can make an informed decision. Most people spend more time deciding where to go on holiday than where they have their operation. It just can't be right. Of course there are some areas where you don't get to choose. I was a nephrologist in the NHS for nearly 20 years. You've got renal failure, you need dialysis 3 or 4 times a week, you don't want to go, and you're not going to go 60, 70 miles away if you can help it. But I think it's even more important when you don't have a choice, when you can't travel, that you can see the opinions of others and be confident that your local service is truly excellent. I'll give one short example of a story, and then I'll keep quiet. 2 months ago, a 35-year-old man phoned our office. We're in a small office just near Oxford. And he phoned up and he said, I just want to thank I Want Great Care. And the lady that answered the phone said, that's very nice, but what, you don't need to thank her. I said, yes, I do. I've just had my brain tumour operated on in Queen's Medical Centre in Nottingham. He said, a few weeks ago, I thought I was completely fit and well. I collapsed playing five-a-side football, and essentially I woke up in the emergency department. Within a few weeks or days, found myself in front of a neurosurgeon. And the surgeon said, you have a brain tumour, you have cancer that needs to be removed. And the surgeon said, I might kill you with the operation, you might be permanently paralysed, and I can't promise I'm going to cure you. And the chap who said to me, my only worry before this was would I fit into my suit for my wedding in a couple of months. He said, cancer doesn't happen to me. I was a young, healthy man. And the surgeon said to him and his fiancée, you're probably terrified now and wondering who the hell I am and if I'm any good. And the chap said, yeah, that's about it. I'm absolutely terrified. And he'd been given all the literature and the brilliant nurse had spoken to him. He said, but I'm really worried. And the surgeon, and any of you who are online now, and I won't do it now, we do it later, he said, when you go home, go onto Google and look me up. Well, 4 or 5 years ago, doctors told people not to go near the internet. It's full of scary stories. You mustn't believe it. Trust me, I'm the doctor. And this surgeon, who's called Mr. White, said, just put my name into Google. And when he put his name into Google, the first hit, the top hit, was his page on I Want Great Care, the individual surgeon's page. Because every patient and every family he sees, he asks them to provide feedback. And he says, because I want to know what they think. That's why I did this job. That's why I put up with the NHS and my managers and all the pressures. B, he knows that patients like to be asked. They like to have the chance to say, thank you, this was good, or this could be better. And thirdly, and this is the key here, he knows one of the most powerful things for the next person coming along that journey is to see what other people said. So when this chap clicks on the page, there are dozens and dozens and dozens of reviews. And people don't like good thanks when someone's been in their head and taken their tumour away or saved the life of their son. They write lots, lots and lots and lots. And this chap flicked through these stories, read them all, and he said, they were people like me. I could see these were people like me. And they said time and time and time again, this man is so kind. He is so good. He phoned me on a Sunday with the bad news. He doesn't shirk the hard bit. His team are fantastic. They're so kind in the medical centre, in the Queen's Medical Centre neurosurgery unit. You can have complete confidence. And he walked over and he picked up the phone and he phoned the surgeon's secretary and said, put me on the list. And the reason he phoned our office was to say, I'm not sure, given all the horror stories I read about the NHS, that I would have had the confidence to have that operation if I hadn't seen what other people had written. And I knew when I went in there that I was in safe hands. That's the power, just one example of literally millions, of patient feedback. It builds morale, it gives patients confidence, it helps the teams detecting poor care, and it highlights excellence. So thank you very much for your time. I hope that's of some interest.